Part 4. Discharge from the hospital. Discharge from the hospital usually occurs 1 to 3 days after surgery. Please ensure that your coach or a designated family member or friend is available to drive you home. Discharge from the hospital generally occurs at 12 p.m. If needed, you may be transferred to a subacute or acute rehabilitation center if your insurance authorizes this. At this point, you should follow up with your surgeon anytime between 1 and 4 weeks after surgery. Home is the best place for recovery for many reasons. By going home, you have a much smaller risk of developing an infection. Hopefully, your home is the most comfortable place for you, which will help you to relax, rest, and heal. By returning to your normal living habits, you will experience less of a disruption in your overall life. You may shower the day after discharge and take a bath after 10 days. If you must take a shower before 5 days, keep the incision site dry. You can use plastic wrap or a large waterproof bandage from your local drugstore to cover the incision. It is recommended that you sponge bath for the first 5 days. Your wound may be completely covered by Steri-Strips and a gauze dressing. The gauze dressing can be changed or removed as necessary, but your Steri-Strips should stay intact. The sterile strips will fall off on their own within 7 to 10 days after your surgery. Do not pull them off, but you should trim the edges as necessary. When leaving the hospital, you may also have a clear plastic-like bandage over the incision. This should remain on for approximately 3 days before you can carefully remove it, taking care not to disrupt your staples or Steri-Strips. Your wound may be closed by metallic staples. Please arrange an appointment with our office to have them removed within 2 weeks of your surgery. As previously mentioned, the more active you are within moderation, the quicker you will heal. Rest and take your pain medication on an as-needed basis, remembering to take the lowest dose at the least frequency you can tolerate. Following this principle, it is important not to take more than your doctor has prescribed at once, and if you are feeling better, we recommend you reduce or stop your pain medication completely. You should wean off narcotics as much as possible within the first 30 days after surgery to reduce risk associated with narcotic use. Remember, after surgery, regardless of the region operated on, you will not be allowed to bend, twist, or lift anything more than 5 pounds. If you are having a cervical fusion, you will need to wear your collar continuously, except during eating and showering. Your physical therapy team will advise you prior to discharge on whether you can go up and down stairs.